So let us start today with our topic. We are dealing with intermittent diseases. We have dealt with alternating diseases and the this non-febrile typical intermittent diseases. Now today onwards we are following aphorism number 235 to 244. 235 to 244 is dealing with the intermittent diseases. Now first thing I want to be clear that you should differentiate, you should be able to differentiate what is intermittent fever and what is chill and rigor. Usually our students have in their mind that those fever which are having this is very sad part of our college study, that many of us are having in our mind that chill and rigor is same as intermittent fever. No, they are not same. There are chill and rigor in intermittent fevers, but every fever which is having chill and rigor may not be intermittent fever. Okay, so first thing you should be clear in your mind that every chill and rigor is not intermittent fever. There may be a chill and rigor in dengue, and dengue is not an intermittent fever. Chikungunya is not an intermittent fever, and this typical Calcutta fever is not an intermittent fever. Okay, what is the definition of intermittent fever? Where there is a rise of temperature and within 24 hours there is a cycle of base level. Okay, patient is having temperature and then returning to base level. That is intermittent fever. Where there is no return to base level is called remittent or continued fever. There are a bit difference between remittent and continued fever. Typhoid is a type of continued fever. Okay, and malaria is a type of intermittent fever where in the course of time, be it 24 hours, be it 12 hours, be it 48 hours, patient will touch the baseline. Okay, at 98.6 or 99, whatever may be the baseline, the patient will have a normal temperature for a period of time. Okay, then again the temperature will increase. This is called intermittent fever. Now this intermittent type of fever is also seen in some other diseases. One of the most common diseases we often miss is urinary tract infection, UTI. Okay, in UTI you will get this type of intermittent fever where the patient is having chill and rigor plus a spiky fever chart, that is the rise of temperature and returning to base level. Okay, what is the fever chart for typhoid? It is ladder like. What is the fever chart for dengue? It is saddleback. Okay, it is saddleback fever. Saddleback rise, constant, then a fall, constant, rise, then constant, then fall. This is a saddleback nature of dengue fever. Means if you put the temperature on a graph, you will get a picture of saddleback. Okay. And malaria and UTI will be fever chart will be there. That is, our patient will be returning to the base level at some point of time during the course of disease. Okay, this is intermittent. It is found in malaria. It will be found in UTI, and it will be found in some kind of lymphoma. It will be found in filaria also. Okay, filaria. A type of intermittent type of fever is also found in filaria. Okay, now so be clear in your mind that every chill and rigor is not an intermittent fever. Now 235, aphorism number 235, with regard to intermittent fever that prevail sporadically or epidemically. Okay, with that non-febrile typical periodical recurring morbid state was not sporadic, nor those were epidemic, has been underlined in previous aphorism, or do not usually appear. Go to previous aphorism number third number line, usually appear, do not usually appear sporadically or epidemically. Now here intermittent fever, this footnote is important, as this is here you will get mention of chronic bark dyscrasia. In the last class also we have discussed that chronic China malady, chronic bark dyscrasia, this is, and the chronic use of quinine, chronic use of cinchona is causing an artificial disease, that is Hahnemann is calling chronic bark dyscrasia. And analogically we have discussed the steroid disease, chronic steroidal disease, chronic insulin disease, chronic disease of penicillin, prolonged use of penicillin, prolonged use of antibiotics, prolonged use of allopathic medicines, like prolonged use of that anticonvulsive medicine. What it is causing? It is creating an artificial disease which is featured by dull comprehension, poor memory. Okay, so these are the artificial diseases still prevail in the society, and you have to deal with this. And what is the treatment for these artificial diseases? There are sadly no treatment available in nature. Okay, no treatment available in nature, very sad part. But nowadays we are, with the help of tautopathy, with the help of advanced homeopathic advanced homeopathic knowledge, we are able to tackle some of them. Like we have many a times we have discussed the bad effect of hormones, hormonal pills. We are giving thyroidinum, aristolochia. The bad effect of antibiotic, we are giving Rustox. Bad effect of other crude allopathic medicines, we are thinking of Keepersulf. These are the medicines which are helping us in treating these artificial diseases. First you have to penetrate these artificial diseases, then you have to move further towards the chronic natural chronic diseases. So sadly the 10 out of 20 cases you are getting in your clinic are suffering from those artificial diseases, or at least masked artificial disease, like masked venereal diseases. What was there? There was a mask of mercurial treatment behind which the natural diseases was there. So there is a mask of these artificial diseases which you have to penetrate, and these allopathic treatment are also causing the susceptibility to decrease. Okay, susceptibility, these patients which are having years together having allopathic treatment are of low susceptibility. So if the susceptibility is low, our potency will be low. Okay, so these patients, remember, those patients who are coming to you for treatment and are on allopathic medicine for years together, think of your similimum giving in low potency. You want to give Nux vomica 10 m will seldom affect any cure, or seldom affect that much effectively as Nux vomica 6 will be acting. Okay, so susceptibility is low. This is my personal experience and opinion. Others may have their experience and opinion to share. but this is what I am doing. I am seeing in my clinic that those patients are which are having years together of allopathic treatment are less susceptible. Susceptibility is so low that you have to give your medicine in low potency. Okay, so this intermittent fever, from where we have started from chronic bar dysphagia. I hope you have underlined that chronic bar dysphagia and that chronic China malady in aphorism number there 280, I think, or 276 footnote. There it was discussed chronic China malady. Okay, 276 footnote, 6th edition, chronic China malady. So now also you will get patients of suffered from malaria many a times in their life. You will get if especially in Calcutta, the patient will tell that I have suffered malaria at least 10 or 20 times in my life. Okay, in these cases they have been treated with quinine. Okay, so keep in mind that you have to face with a quinine disease or this bar dysphagia also. Okay, so you may start with Chinimum sulf or Cinchona itself, or you can start with malaria off, or you can start with Natramur, and you can start with Ipecac. All these medicines which are having bad effect of quinine intoxication, quinine intoxication, having all these medicines having role to play in quinine intoxication. Okay, Natramur, Ipecac, Chinimum sulf, Cinchona or China, and malaria off. Okay, if you are getting more features of malarial disease than of quinine, think of malaria off. Malaria off is a nosode developed from not actually the malaria virus. There are medicine developed from malaria virus also, but malaria off officinalis is a nosode. You may call it nosode developed from decayed vegetable. Okay, and very helpful in treating these type of cases having a history of malaria. Malaria officinalis, it is available. This medicine is available in Calcutta. I don't know about other places, but it is available in LM potency as well as in centesimal potency with HAPCO and international. So this malaria officinalis is having number one feature of history of. In the past history, I have discussed previously that reading any of medicine, you have to read it in different categories like current presentation, having present complaint, having on observation, what you are able to observe. Let me open my whiteboard